Welcome to the City Current Show, powered by Higginbotham Insurance and Financial Services.
This show focuses on sharing good news and powering the good in our community. Now here's your host, City Current CEO, Jeremy Park.
Welcome back to the City Current Show, powered by Higginbotham. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And we always love having our City Current partners come on the show talking about their world and sharing their expertise. And that's why we're always honored to have with us our City Current partner, Will Brown, managing partner with the Benefits Group. How are you doing?
After that, man, I mean, how could I not be good? I say it every time, but I'm taking you around with me, like just to announce me when I walk into a store.
I'll be your hype man.
And then the Kroger, like, you'll be the hype man. Yes. No, I'm doing great, man. Thank you for asking.
Well, you're always a great one to have because you share such great tips and knowledge when it comes to benefits and talking about what small businesses can do to offer Fortune 500 type benefits and how to save money. So let's go ahead and dive in. When you talk about the Benefits Group, let's start with some background. Give us a little bit of your world. Describe the Benefits Group.
Benefits Group has a lot of passion, led by me in that front. I love what I do. We help small to mid-sized businesses offer Fortune 500 benefits, period. We're good at it. We have groups from 2 to 200 employees. Most of them are in the 10 to 80 range or under 100. Not that we can't help the larger one. It's just that I'm typically dealing with the owner, somebody that really cares about the work family. They're not a commodity. And they appreciate the reduction in cost. They see it. They feel it. Background is in public accounting with Deloitte, go into consulting, see behind the curtain of these small businesses that benefits are very high impact, low technical aptitude. Most brokers are order takers, product peddlers, the old school, service model, especially for the smaller group, is not there. And it's not sustainable. So I'm a business owner myself. I get the small business owner, and we hire more than we need. We have good capacity, and it's been controlled growth referral. So that's kind of who we are. I mean, we are just like you, the business owner. We get it. We spend money. We pay taxes. And I just have a passion for saving money and helping the small business owner. And the way we execute that is really through benefits, because it's a very high impact. As I said, it's one of two conversations you're having when somebody's coming on board. Benefits and compensation.
Absolutely. So let's dive in. When you talk about benefits, obviously health insurance, dental insurance, and vision, but it feels like when you talk about benefits, it is ever evolving. And so when you say benefits, talk about the different benefits.
There are a lot of them that we can do through carriers. So there's the disabilities of the world, the long-term, short-term. There's the group life. And by the way, I will tell the small business owner, if you can't offer medical, a lot of them think that I'm too small and I don't want to do the medical, and we could talk about that there at the end. But offer a great dental and vision, something with a very high benefit output. But long-term disability, Jeremy, group life is a very low cost, highly valued or perceived value. And if you can offer a group life and you've got these newly adulting staff that's between 28 and late 30s, whatever, they're not going to sit down typically with an agent, go through the process. So if you can give them life coverage, and it's so low cost, I mean, really a couple bucks per person, you'd be surprised, and give them something and say, look, if something happens to you on my watch, God forbid, I don't want to have to tell your family, like, oh yeah, here's a brown box with his or her stuff in it. No, here's $100,000 life insurance. At least you're not having to borrow money to bury someone. I know that's grave sounding, but it's the reality of life. And so they could do that. There's mental health is real big. There are a lot of benefits, not only in the telemedicine, but there's things employers do. Gas cards, sending DoorDash, on a Friday night to your team and just saying, hey, don't cook. Mobile car wash, you're out in the parking lot. An ice cream truck that comes by, you can call those and schedule. I know a friend that did it. It doesn't have to be just the typical benefits that we help. We also try to let them say, like, hey, let's get creative with this. So yes, we can help with all kind of areas.
Talk about, for especially the small businesses, You've got a threshold under 50 where people, do I offer benefits? Do I not? But talk about the power, especially for the small to mid-sized businesses, of offering those Fortune 500 type of benefits because of the talent attraction and retention. So, in other words, talk about why this is so important.
Yeah, absolutely. Well, as I said, one of the first two conversations, especially with the millennials, especially with Gen Z, your benefits tell a story, whether you want it to or not. It's either going to say, I took the time, energy, and effort to care about you rather than just saying, hey, there's a coffee pot and maybe some brownies that I brought from home as my benefit offering. Or you present them with this fully curated cafeteria plan, an enrollment site, a really sleek and sexy looking enrollment guide. We do all that for you. We're going to make it look like $1 million. What story does that tell? So what? You have 10 people. I always tell small business owners, act as if. Just because you're small doesn't mean you can't act larger. But they're going to be benchmarking you against someone else. And if I'm picking your company, Jeremy, and you've got your smaller group and I love your culture, and I'm picking this other company over here and you offer nothing, maybe, you just say, hey, you don't even have a clearly defined time off policy. Or I go over to this group over here. They got dental, vision, medical. So it's very important. You are telling a story. You're competing against people that do offer it, and the caliber of people that it attracts. And by the way, it's not going to cost you as much as you'd think. I mean, there's ways to get around this and still offer great packages we talked about. So yeah, it's definitely important.
Let's talk about cost because when you talk about health insurance, where do you see health insurance cost premiums? Where are they right now in terms of a trend? And then let's talk about some of the different ways because you're really good at offering tips,
Yeah.
but talk about some of the different ways companies can be strategic to lower costs.
Okay. Well, humor me here for just a few minutes because I won't get into the weeds, but here's the reality of it. The, there's a plan type called fully insured. A lot of brokers offer this. This is just the cookie cutter prepackaged. Okay. It's not based on your group. Um, there's a lot of levers without getting too technical that you can pull. And one of them is giving an underwriter information. Information is key, right? If I'm asking you to insure a risk, but I don't give you any information about that risk, you have to charge the highest possible premium, right? That's what fully insured is. With most of our groups, there's other funding platforms. Again, I won't cloud the issue here, but just know that with just providing a little bit of information about your group, some demographic information, we can get rates down 40, 50, 60% lower than the market. So the typical market rates are high and they're going up, but that's because most brokers are not creative. I spend most of my time interviewing different carriers and what's called TPAs or third-party administrators with what's called their stack. What is your cost containment? What are you leveraging to save money? Is it a regional network? Is it your pharmacy benefit manager? I'll stop there, but just know that there are levers that can be pulled. Most brokers are they're old school, man. They've just grown, have been in it 30 years, and the times they are changing and they're not keeping up. And so the small business owner, is missing out. If you go to a very large organization, there's probably the technical know-how. But for our smaller folks out there, they don't get that. And so you can actually, here's what I'll land on. Under 50 lives is not compulsory. We established that. You don't have to give 50% of the premium. My job is to get you the lowest possible top line rate. Do it all the time. 95% of the time, competitive situation, we win, period. But when I get you that low rate, it doesn't mean you have to pay half of it. I tell the smaller group, I say, look, budget. If you can afford to give $100 per person, you got 10 people, then you say, I'll spend $1,000 a month on benefits. I'll give them $100 each to go shopping with, off an already low rate. That way you can budget a fixed cost. They're happy. They get a pre-tax premium. So there's a lot of ways to jump into this without saying I'm not doing it at all. We have plans that are like a gap plan where you take a very high deductible, but you fill it with a gap, and the two together make like a platinum product. But because we spread the risk out, the insurance risk, there it's the cost of like a bronze plan. So the cost, if you looked at it at its face and you talked to a broker and they just gave you the cookie cutter, it would be expensive. But that's because they're really not showing you all that's out there. They're not studiers of their craft typically.
I'll let you go in either direction because you've on different episodes in the past shared different ways that the individuals can save money by
Yeah.
really just being aware of where they're spending money and asking and saying, can I see a bill, an itemized bill? Can I know where, these dollars are going? And so being proactive on your own health and taking charge there, that's one piece of it because all of those costs add up. And then two, on the company side, as you mentioned, giving information, but you've also offered different tips in the past too, where they can be creative with different structures and types of plans to be able to save money. So when you talk about taking control, being proactive, putting yourself in the best position for success for lower, dollar amounts, give me maybe one or two tips on either side of the equation.
I'll give you both. And I'll preface it by saying the reason, people love to complain about the broken system. And yes, it is broken. There's a lot of fraud and waste. And that's a lot of times at the higher level, the hospital systems, there's so much that goes through, they don't have time to audit it. My industry is broken. We don't educate. But the number three, which you're talking about, is healthcare consumerism. It is imperative upon us as consumers to know that when we hand a card, we're buying something. So for the employer side, we'll start there. One thing they could do, I'll just give you one little tip. It sounds like self-insurance, but it's not. I'm going to show you how. Let's say you've got 10 people and you say, okay, I'd like to give a $3,500 deductible, right? That's reasonable. But I'm going to go with a $5,500 deductible, okay? And I'm going to save by doing that. I'm going to save probably about 24,000 a year, right? 2,000 a month typically across those 10 people. So I've saved 24,000. Now, what I tell my group is, hey, we've got a $5,500 deductible, but I'll self-insure the donut hole on the back end, knowing, Jeremy, that only about 3% of people will ever cross that 3,500. And even then, they may cross it by 500 or 1,000. But even worst case scenario, every person crossed the 3,500 and hit the full 5,500. So you're responsible for 2,000 in deductible, the disparity between 5,500 there for 10 people. That's 20 grand. You save 24 in premium. So the chances again, percentage wise, you're not going to do that. So we show them how the concept, they go, oh, self-insure, but you cover the back end of the donut hole, make it feel like 3,500, knowing most people never cross. That's one way. For the employee, there's tons of stuff that we'll do when we're educating, but I'll just give you one tip now that's different than what I've given before. The surgical theater. Here's an example. If you go and if you get a knee surgery, if you look at your EOB, your explanation of benefits, you'd be surprised how little the surgeon gets, comparatively speaking. So if that surgery costs, 30 some $1,000, honestly, that surgeon might get $1,200 of that. The rest of it is the hospital facility. So you can ask your provider, and I know because I've asked, and I have doc friends that say, hey, I see you practice at Williamson Medical. I'm just spitballing. But do you have an outpatient program or an ambulatory? And that cost now of that knee surgery goes significantly down because most of it at the hospital center, but the outpatient or ambulatory surgery is a lot less. Now, they did say they'll test you first. Like if you're at risk, you're a high risk patient, maybe you're more senior, you've had heart issues, they may want you in that hospital setting. But someone like you, yeah, you ask them and they'll say gladly, yeah, or I practice at this hospital and it's less. So even just choice of venue, keep your doctor, but know that they practice in different arenas.
Yeah. That's why I love having you come on. Like both those extremely creative, but it's taking control, right? It's being educated, being proactive, taking control, because at the end, it's your money. And so I think on the business side and the personal side, so I just appreciate the creativity around what you're talking about and just, being proactive and giving good tips. Give me one more thing, obviously kind of broad, but give me one more thing that you wish everyone knew when you talk about what you do and why and the power it has to save money, but also to take care of people. Give me one more tip that you wish everyone knew.
I wish every employer knew how important it was. When they think of benefits, they think of something perfunctory, technical, cost, but they don't see what I see. I tell my team that there's a story being told here. We see marriages, we see births. I tell my team it's not just, oh, I have to offer something. It's that new mom taking their child to the pediatrician and 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 having that card for the first time, make sure they're covered. There's a lot of stress and anxiety. So what I want the employer to know is that offering benefits is something that you're doing that is really necessary, because outside of the employer sponsored plan, that poor employee has no other venue. Typically, there's healthcare.gov, but that's the high risk pool. It's priced differently. It's exorbitantly priced, 3 or 4 times as much often. So you just offering and making it available, even if you didn't put anything with it, is still an option that they don't have access to. So the employer has a really big responsibility in doing that, because otherwise they're left to find it, and try finding individual coverage yourself. It doesn't exist outside of the healthcare.gov, the exchange. Let me know if we have time for one other thing. I would love one more tip. Do we have time?
Go ahead. Yeah.
For you smaller employers out there, I mention this because I was told by a little 2-man group that was starting up. They didn't, no other broker they talked to mentioned this to them. It's called an ICHRA. So maybe you're not big enough for a health plan to start, but you want to give your folks a subsidy. Don't put it in their paycheck and have them taxed on it. That's not copacetic. We don't want to do that. You want to get some sort of qualified plan that's above board and gives them money to be able to take. And the ICHRA, ICHRA, it's a newer form of the old QSERA, the Qualified Small Employer HRA. And basically it allows a conduit so Jeremy, it's me and you. You want benefits, but I don't want to set up the structure yet. We don't have enough people. But I want to give you $500 to be able to carry to your spouse's plan, perhaps, or maybe to the exchange. There's an ICHRA, and we can tell you who to set it up with and how to do that. We're not even involved. We're just knowledge based. We truly feel about helping. It's not about us. So there's a third party that does that, but just know that exists. So,
yeah.
FYI.
See, that's once again, so we love having you come on. So where can we go to carry this conversation forward? Because obviously you're full of great tips. You're constantly putting out good information. So mention website. Where do we go to connect with you and your team?
I would say the best one is thebenefits.group. That's THEBENEFITS.GROUP. There is no .com. .group is the extension. Guys, I will tell you, I'm really trying to promote that going forward in 2025. We have an intake link where it says I'm a prospect. The intake link is not just this 5-line contact form that most of us hate because you don't know where it's going. You don't even know if anybody sees it. This is a fully integrated, would take you about 8 minutes to do. There's videos along the way to explain where you're at. It's fully interactive and allow you to upload a census, put in your information. If you just want a quote, you don't want to even talk to anybody. I don't know why you wouldn't, but no, I'm just kidding. But you could send that in and we can send you back some quotes, and then you could see if it's right for you. So try that intake link. Small business owner, 10 o'clock at night, you're shopping benefits, go there. I think you'll appreciate it. Asks what you need and then gets it right into our project management system.
Well, Will Brown, managing partner of the Benefits Group, thank you for your City Current partnership. Thank you for all you do to power the good. Thank you for coming on the show.
Love being here. Thanks, bud.
Higginbotham Insurance and Financial Services is proud to power the City Current Show. We're a people-first company that protects what matters most, the families, businesses, and trailblazers that keep our community going. As one of the nation's top independent insurance firms, Higginbotham is a single-source solution for business insurance, employee benefits, HR services, and personal insurance that's customized for you. We're here to serve you, the people you care about, and your community. Call 866-377-1959 or visit higginbotham.com.